Hello, everybody. Dr. Julie McLaughlin here from Vital Health Protocols. It's been a long time since I've been here on the show and about that today. So let's get started. We're going to be talking a little bit about COVID. And I know that we're so over it. We're just done hearing about COVID. It's just messed up the world, and we think, well, if you get over it, you have a box of tissue and you're good in a day. But I got to tell you, there's a lot more to it. There's a lot more to it that most people don't even know until it happens to you. So let's do this first. Let's thank ChiroSecure, because without ChiroSecure, none of us would be here. So I want to do, thumbs up, little hearts, because they are so great. They sponsor so many educational programs for us, and they not only are our malpractice carrier, but they are much, much more. So let's make sure we give them all the love that we can. So I want you to know that COVID can happen to anyone. And I know by being in these women's chiropractic groups and these chiropractic groups, it's happened to a lot of docs. And I'm also in groups with tens of thousands of other people who have something called long COVID. And last spring, I got COVID. And it actually, I think, was my second time getting it. The first time was way back in the beginning of 2020 when we didn't have tests and we didn't know. And we're not going to talk about vaccines because we don't want to have any issues. This can happen to anyone. It doesn't matter your vaccine status, and it can happen multiple times. It really, really is a huge, huge deal, but it's different for every single person. So I'll tell you a little bit about what happened back in the spring. I felt a little sick and I thought, oh, I just have a little cold, or maybe it's the spring. I have some allergies. And I went about a week, and then all of a sudden I lost my sense of taste and smell. And I got tested and I was positive. The other people in my family also got tested and they were negative. Um, so I thought, okay, I'm just going to get better at home, and everything's going to be fine. Well, long story short, it didn't get better at home, and I started getting worse. I started losing my ability to breathe. My pulse ox went down, and I went into the hospital. And they did some fluids and they did a little bit of testing and said, "You're okay, go home and you'll be fine." Well, 2 days later, I collapsed on the floor and couldn't breathe. I couldn't talk. I couldn't stand up. I had to have an ambulance come. Now, this is the first time in my entire life that I've been sick. I I don't even want to tell you how old I am, but I've never taken medications, nothing. So it's the very, very first time I've ever had any kind of illness, because I've been practicing functional medicine and chiropractic since I was in my 20s. And I never had a need for this, but this time it was totally different. And so when I went into the hospital, I was there for 5 days and they did every treatment you can even imagine on me. And I came out and I was a little bit better. And then another week went by and I was back in the hospital again. So the thing is with COVID, and I'm going to talk about the symptoms, and I'll talk about the symptoms in what I experienced and what the studies show and what other people are experiencing, because you are seeing this in your practice and you're seeing it pre-vax, post-vax, pre-COVID, post-COVID. You're seeing with people with multiple COVID test positive. I know at least multiple people that have had COVID 3 times. So we want to look and make sure that we're not missing anything. And I want you to make sure ChiroSecure has an excellent informed consent form that I want you to make sure you download from them about COVID information and have all your patients do it. It's super, super important to document this in your notes. And as we go on, you're going to see why. So when we look at just the clinical course of COVID, and this is what the CDC says, that it's about a 6-week course. So initially you get your exposure and it's like 5 to 6 days, and then you get symptoms, and then most people recover in 2 weeks. Or if you get it really severe, you recover in 6 weeks. But I can tell you with long COVID, the recovery is a year to a year and a half. And that's really as long as we know COVID's been around, because some people aren't recovering like that. So 30% of people who get COVID experience long COVID, and 85% of people with long COVID had the mild form in the beginning, it never even needed to be hospitalized. So we have it in our minds that the people who are getting long COVID are people who were on ventilators and happen to be hospitalized. But that's not the case. The vast majority were never hospitalized. And so it's a scary, scary thing when you don't know that you're not getting better. So we're used to getting a cold and flu that we get better from. We're used to have back pain that you get better from. This morphs. It's very, very deceiving because it morphs and you just don't get better. So, what long COVID does is it just stays in your system and the symptoms change. So, these are the different phases. There's acute COVID, and it's really important to look at these timelines because the sooner you can get somebody treatment, the better off they're going to have to alleviate the long haul. So, the acute COVID is the first 2 weeks of symptoms. Post acute COVID is up to 12 weeks of symptoms, and chronic COVID is greater than 12 weeks of symptoms. Once you hit greater than 12 weeks of symptoms, that's when you know this isn't going away anytime soon. And long COVID really describes those symptoms that are happening after those 12 weeks. So when we look at how do we determine somebody has a mild case versus someone has a critical case? Because we always think that, you either have it where you need a box of tissue for 2 days or you're in the hospital on a vent and not recovering. But there's a lot of places in between. So I want you to look at these categories. In the mild case, you're going to have the typical cold and flu symptoms, right? Some GI symptoms, as well as loss of taste and smell. There's going to be no pneumonia on the chest x-rays or chest CTs. There's no evidence on any of the testing. And you're going to have no shortness of breath at all. In the moderate cases, you're going to have radiographic findings of pneumonia. You're going to have fever, and you're going to have a lot of respiratory symptoms. And then the saturation of oxygen is actually going to be below 94 on these people in room air. In the severe cases, and this is where I fall into this, the saturation of the oxygen is going to be below 94. And then some of the partial oxygen is going to be below 300. There's going to be infiltrates in the lungs, at least 50% within 24 to 48 hours. So, and COVID is a little different. I'm going to show you an x-ray how those infiltrates get into the lungs. The heart rate's going to be very rapid, above 125. And like my resting heart rate has been 110. So as long as I'm 110, that's my resting heart rate. This COVID does crazy, crazy things to us. And then the respiratory rate is going to be greater than 30 breaths per minute. Now, in the critical ones, they're going to have respiratory failure. These are the patients needing to be on ventilators. And it happens very, very quickly. It's not a long, drawn out thing with this. They're getting sepsis, they're going into shock, and they're having multi organ dysfunction. So when we look at these categories, we want to say, well, really, the people in the severe and the critical are going to get long COVID. False. It's not true. You can get mild COVID and still get long COVID. You can get the vax and get long COVID. So we're going to talk about, oh, my slides are a little goofy here. Sorry about that. But we're going to talk about 8 organ systems that are affected by COVID because we just think of it as a respiratory thing, but it affects all the tissues that have ACE2 receptors on them. So these are little receptors that COVID can kind of plug into and affect those symptoms. So we're going to look at the heart. We're going to look at the circulatory system separate from the heart. We're going to look at the lungs. We're looking at the brain and the central nervous system, the thyroid, the kidneys, the liver, and the GI system. So the most common symptom with COVID, with long COVID, is that your symptom will change. Whatever your symptom is, you better be ready because it's going to change. And you're going to think your patients are making it up, or if you have it yourself, I was thinking, am I imagining this? How could my symptoms change so much? So you get one symptom and it morphs into another symptom. And maybe that first symptom stays, and maybe that first symptom goes away. So most patients with long COVID have an average of 20 symptoms. There's over 50 symptoms altogether, but the average person has more than 20. So think about our patients when they come into our office and they have lower back pain. That's one condition. Think about 20. So when it affects the heart, it gets myocarditis and tachycardia. And the tachycardia happens if you walk down the hall to the bathroom. You can go from laying to sitting and your heart races. And this is what's been happening to me. And it's also considered in dysautonomia, which affects these same symptoms. So the next one is the circulatory system. And really, COVID is an endothelial disease. It affects the lining of our blood vessels. And we usually don't talk about the lining of our blood vessels unless we're talking about plaque and heart disease. But it causes clotting and it causes microvascular damage, which causes hypoxia. And it actually causes your tissues to be starved for oxygen. And that's one of the reasons people get COVID toes. And I can tell you, I have oxygen that I'm actually on 24/7 right now as a result of COVID. I'm not wearing it because it would be really noisy for me to talk with you, but that hypoxia affects every organ in every system in your body, not just your lungs. So, the lungs, obviously, the big problem is the SARS CoV 2 pneumonia, and that can lead to fibrosis, which is permanent scarring in the lungs. Now, I had a CAT scan originally when we first started COVID, and now I've had it 3 months later, and it hasn't changed at all. It hasn't improved. Now, normally, pneumonia always improves. I want to show you this little picture here. So, on the left is a chest x ray of someone with COVID. And see those white, cottony, fluffy patches? Those are the COVID pneumonia. And the difference is it affects both lungs, it's bilateral, and it really shows up in the periphery, which is not really common where the other pneumonias show up. And it will show up as ground glass. Like for me, myself, I have ground glass in all the lobes of my lung on both sides. So my perfusion is really poor. On the right, just to give you an idea, if you're not used to looking at chest x-rays, that's a clear chest x-ray. So those cottony, puffy things on a CT scan look like paint splatters. You see that all the little alveolar sacs have paint splatters in them. And I think of it like super glue, where it glued those alveolar sacs closed and you can't get any oxygen exchange through them. And if you can get it back, it takes a very, very long time. But in the meantime, it affects your other organs. So let's talk about the brain. The brain is a huge one that COVID affects, and the central nervous system. It causes strokes because of the blood clot. It causes mast cell activation, which is a histamine response. And we can talk about more of that later. I have so much information to tell you. I just want to get you an idea of thinking about these things when they walk through your door, or if you or a loved one are experiencing it. It can cause seizures. It can cause Guillain-Barrés, brain fog, where you're inserting wrong words. I was looking at a menu and I thought it said cemetery chicken. Now, nobody would ever serve cemetery chicken unless it was some kind of, crazy Halloween stunt. But it makes you have the wrong words in the wrong place and makes you have memory problems, dizziness, central nervous system dysregulation like POTS. We all know what POTS is, and it causes neuroinflammation. It causes PTSD, anxiety, and depression in people who have never had it before. So it affects the brain and our central nervous system in so many ways. As chiropractors, what do we deal with? We deal with our central nervous system. So chiropractic care is super, super important for patients suffering from long COVID. It affects the thyroid. It can make the thyroid either hyper or hypo. And the other thing it can do is it can cause new or exacerbated autoimmune conditions. So this is one of the big things that we see is a triggering of autoimmune. In the kidneys, it can cause low urine output. It can cause frequent urination. It causes all kinds of kidney dysfunction and even kidney failures. Wherever that COVID virus hits, that's where you're going to get your symptoms. Or if you didn't get the symptoms starting out there, it may morph into a different system. The liver, due to the rush of the cytokines in the liver can become damaged. In some cases, it's not repairable. In most of the COVID patients, you'll see very high liver enzymes, and that's a result of those cytokines, that inflammation in the liver. when we talk about the GI symptoms, some people get this really, really bad where they're getting nausea and vomiting and diarrhea and pancreatitis, and it's a barrier issue. And they're finding that if your gut biome isn't healthy, that's going to contribute to it. And we know an unhealthy gut biome also affects the brain. So, one of the things that COVID does is it can expand the viral burden of other viruses that you may have had in your body already that were dormant, and it reactivates them. And like 78% of people who have had Epstein Barr before, it will reactivate it. And same thing with chronic fatigue syndrome, HSV, parvo, mycoplasma, and even hepatitis. These are viruses that stay in our body that COVID will come along and reactivate. It is a very, very sneaky virus. So, some of the other words that are called long COVID that you might hear is the PASC, PASC, that's post acute sequela of SARS CoV 2, or persistent COVID, or long haulers, or post acute COVID, or chronic COVID, or post COVID syndromes. I want you guys to know this because you will have patients walking into your office having these things, and I don't want you not to know it. I can't tell you how many places that I've been and they had no idea what this even was. And they thought, oh, you must be contagious. No, long COVID, you're not contagious. That contagion stage is very, very short. And so this is people who are having 12 weeks or longer of symptoms after COVID with no other explanation or diagnosis. So, what are the triggers? Why do 30% of people who get COVID get long COVID? And these are the things that I've come up with the research so far. The number one is genetics and gender. So women tend to get it more than men, and genetics. And now they don't know what gene, but that's what's caused mine. There's some kind of genetics that has triggered me into this long COVID because I had no pre-existing conditions prior to this. I was perfectly healthy. In fact, when I went into the ER, they gave me a Z-Pak, which is a very common antibiotic, and I had a terrible allergic reaction to it. And they said, how could you have had an allergic reaction to this? This is such a common antibiotic. I said, well, I've never needed antibiotics my whole life. So when you see that people can have pre-existing things that could lead you into this, or you could just have genetics. So people with diabetes are going to be more likely to get long COVID. Obesity is a trigger, cardiovascular disease, menopause or menopause. So low testosterone or low estradiol, that can trigger you into long COVID. Autoimmune conditions, anybody who's immunocompromised already can trigger them into this long COVID. And this is a really interesting triad that a large percentage of the long COVID patients have. If they have asthma, eczema, and allergic rhinitis, all those three together, they have a higher chance of getting long COVID. So there's no guarantee on who will get it and who won't. I always think of it, when my kids were little, we'd go to the grocery store and they had those gumball machines and they get a little bouncy ball and it's got all the angles on it. It's not round. And every time you drop it and it goes in a different direction, that's what COVID is because it's going to go in a different direction every day, every time, and every person is unique. So you need to be a really good diagnostician when you're looking at these patients. So because it's so new, we don't know everything about it. And if anybody out there is telling you they know everything about it or they have all the answers, they're lying to you because every single patient is different and you have to treat that patient individually. But it could be a collection of 4 different syndromes: a post viral fatigue syndrome, a fluctuating multi symptom syndrome, lasting organ damage that you have to deal with, and post intensive care syndrome. So people who have been in intensive care and on ventilators, they have a whole nother hurdle to get over with this long COVID. But these symptoms fluctuate, and there's significant psychological and social impact on the long COVID as well if you don't manage it. We've all had that psychological, social thing because of being locked up with a pandemic. But when you add these symptoms on top of it, it can really be overwhelming. So, really, there's more than 50 symptoms of long COVID, but the most common symptom I want you to know is that your symptoms will always change. In the beginning, I lost my taste to smell and taste. Then it transformed to they just weren't right. Like if I smelled cinnamon, I knew it was cinnamon, it smelled like lemon to me. Then I decided, okay, my body doesn't want to do that anymore, or my body decided for me is more like it. And I was smelling cigarette smoke 24/7. I've never smoked in my life, and I don't go anywhere where there's smoke. So COVID does these crazy, crazy things, and you think, what is going on? So let's take a look at some of the symptoms. These are the symptoms. And if you want to really look at these, you can pause on the replay and you'll be able to see all the symptoms. And so patients coming in with these symptoms might not even realize that it's long COVID that they have. At first, I didn't realize that I had long COVID. And when you see all of these symptoms, they could be anything, any kind of organ system, anything, but don't get fooled by this. When we look at what the list is, 26% are pain symptoms. Now we're going to get patients walking into our office with pain and they can't describe it. And a lot of times it can be bilateral pain. I have patients with bilateral ankle pain, knee pain, and hip pain that they've never had before. I've got shoulder pain and elbow pain like never before. So these things are going to show up. Constant burning in the bottom of the feet, pain in the middle of the back and the thoracic spine. So I want you guys to be aware that the long haulers, we always think of respiratory, but it's so much more, and they're going to show up in your office. So nearly 30% of infected people, like I said, get long COVID, and 75% of them have never, or 85% of them have never been admitted to the hospital. But if you take the people who were hospitalized, 75% of the patients who've been admitted to the hospital have abnormal patient outcomes 3 months after the onset. That's huge, right? Think about, have you ever been sick for 3 months? And 50% of the patients admitted to the hospital will have symptoms 12 months after the onset. And a crazy thing is, at the 6 month mark, the studies show that the symptoms can be worse than they were at 3 months, but then at 12 months, the symptoms could be worse than they were at 6 months. So you can think you're getting better, right? And you hit 6 months, you think, oh, I'm getting better. And then you hit 12 months and your symptoms can be worse than they were 6 months ago. So it does, you don't get better in a linear pattern like most other conditions. So, how do we assess if someone's getting better, how someone's getting improved? And it's a really hard thing. So, I read one study said that improvement could be up to 5% a month. Now, can I just tell you, I've been sick for months and months and months. That is painfully slow. And it makes you think that you're never going to get better and you're not getting better. So, I want to give you some tools to be able to use with your patients in your practice. And these are some really helpful symptom inventories that are subjective that the patient fills out. And I would have them fill them out every month to make sure that they are getting improvement and that they can see it and you can see it. Because 5% in a month, day by day, you're saying, I'm not getting better. Or if one symptom goes away and another one comes on, and that symptom may be way worse, you're thinking that you're getting worse instead of better. So these symptom questionnaires really, really are helpful, and they're available everywhere online as PDFs. Are very, very common, but we don't typically use them in our practice. But it's a great way to assess the patient in the beginning, but also look at the progress. So I can tell you the pain and suffering is real. I never realized what COVID was possible to do. It's really destroyed my lungs. It's destroyed my heart. It had so much pressure on my heart that they had to put me on oxygen 24/7. And if I walk, 10 feet, my heart rate skyrockets up to 160. My resting heart rate's really, really high. It changed my sense of taste and smell, and that's the least of it. It affects your GI symptoms. It affects the brain fog where you're putting different words in and it affects your memory. It makes you shake. It makes you have dry mouth. It has so many symptoms that you can't even realize it. So I want you never to experience this, number one. And I want you to recognize it when your patients come in, that these symptoms are real and they need someone to listen to them and to support them. And I can tell you that there's no better place for them to get support and get adjusted in your chiropractic office and help get them through these really, really tough times. And at the end, most people will recover, but the pain and suffering during that time is real. So please support your patients and be aware that these symptoms are coming in and that they're real. They're just not to be sent out to every specialist in the world because they're looking at their little niche. Put it all together and look at the possibilities of long COVID. So I would like to thank ChiroSecure. If you guys have any questions, please let me know. We only scratched the surface today because it's a huge, huge topic, but at least it will start getting you thinking in the right direction. So lots of love to ChiroSecure, and I will be talking to you soon. And remember, it doesn't matter if you're vaccinated or not vaccinated, long COVID happens. And if you had COVID one time and it was mild, any combination that you could possibly think of can happen with COVID and long COVID. And it's not just in these little boxes that people like to put them in. So you have to be aware it can affect anyone at any time. So I'm Dr. Julie McLaughlin from Vital Health Protocols, and be sure to tune in to Empowering Women in a couple of weeks, and they're going to have a great show for you. So we'll talk to you soon.
Join us each week as we bring you the best in business growth, practice management, social media marketing, networking, leadership, and lots more. If it's about women in practice and business, you'll hear it here. We hope you enjoyed this week's Facebook Live event. Please like us on Facebook, comment, and share. We look forward to seeing all of you next week for another episode of Empowering Women in Chiropractic. Now, go ahead and hit the share button and tell your friends and colleagues about the show. Thank you for watching. Have a beautiful day. This has been a ChiroSecure production.